Patient appointment cancellations and no-shows. Introduction. Indian healthcare system demand is way more than supply of qualified and trained health professionals to consult with. There are always long waiting queues in most second and third tier cities. Simultaneously, situation in metros and Class A cities is different. In metro cities, and super specialty clinics, appointment cancellations, no-shows and just before rescheduling impact revenue and efficiency of clinic, hospital or practice more. Patient no-shows and appointment cancellations are significant problems for the healthcare sector. The practice will lose money when patients cancel their appointments, which will have a negative effect on their financial situation. Every medical practice experiences the occasional missed appointment, which can even feel like a welcome reprieve in an otherwise crowded schedule. However, last-minute cancellations and no-shows cost your office money and may even have a negative impact on the health of your patients. The reasons why patients no-show for imaging visits are explained by a recent study. Researchers discovered that the two factors most strongly linked to rising no-show visit rates were modality type and scheduling lead time, NSVs. When a patient cancels or is unable to keep a scheduled appointment because of financial constraints or other practical difficulties, it is referred to as a patient no-show. By using technological solutions like the patient scheduling EMR or EHR software system, healthcare institutions have been making an effort to address this problem. Patients can book appointments online with the reliable patient scheduling software, giving them more control and assisting physicians in filling their schedules. Patients want medical facilities to use digital tools so they may easily access appointment scheduling on their cell phones. Patient satisfaction ratings may increase as a result. Providers increase patient engagement levels when patients may arrange their own appointments, which can bridge any treatment gaps. Many clinics use methods that may be hostile to patients to prevent patient no-shows, such as double booking, which results in longer wait times when both patients show up, and charging fees. No-shows from patients are undoubtedly inconvenient, but clinics must be prepared to put themselves in their patients' shoes in order to comprehend why they are skipping appointments. Practices can develop better solutions to the issue of patient no-shows and, in the process, better serve their patients by first empathizing with their situation. Impact of appointment cancellations and no-shows. Patients who do not show up for planned clinical visits disrupt the clinical workflow, the patient care system, and the efficient administration of care. According to studies, 1 in 5 appointments are missed. No-shows cause more harm than merely a time waster. You are paying for them. Inadequate scheduling can have a significant negative influence on your profitability and business outcomes, especially considering the high patient no-show rates that are common in the radiology sector. The average cost of no-shows in the healthcare sector is estimated to be $150 billion yearly, according to a widely used figure. According to another statistic, primary care providers lose $150 to $200 in lost revenue for each missed visit. Aside from the financial numbers, no-shows are a bothersome issue that every practice must confront occasionally. It helps to comprehend the causes of missed appointments and what we can do to lessen their occurrence in our practice in order to limit the number of hassles and costs to our productivity. Another study indicated that only roughly 60% of booked appointments in family medicine clinics were filled by walk-in patients after cancellations, and no-shows accounted for nearly 1/3 of all scheduled appointments. Missed opportunities to provide health care have a detrimental effect on the general health of the patient population and decrease the effectiveness of departmental operations. Increased morbidity and death might result from delayed diagnosis and treatment. No-shows have a detrimental effect on other patients as well because another patient may have been photographed in the empty time slot. Aside from the more visible loss of income brought on by an unutilized visit, there is also the sunk cost of using human resources for scheduling, deciding on an examination technique, and obtaining financial pre-authorization.